How is a biopsy for transitional cell carcinoma performed? Imagine trying to find tiny clues inside the bladder that could tell us if cancer is present. That's exactly what a biopsy for transitional cell carcinoma involves. It all starts with a procedure called cystoscopy, which is a minimally invasive way to look inside the bladder. During cystoscopy, a doctor gently inserts a thin, flexible tube called a cystoscope through the urethra, the natural opening at the tip of the penis, or in women, into the bladder. The cystoscope has a small camera and light attached, allowing the doctor to see the lining of the bladder clearly on a monitor. Once inside, the doctor carefully examines the bladder lining for any suspicious areas that look abnormal or unusual. To get a tissue sample, the doctor uses special tools passed through the cystoscope. One common method is the transurethral needle core biopsy, where a tiny, specialized needle is used to take small cores of tissue from the bladder wall. This technique is less invasive than other procedures and is effective in collecting tissue from deeper layers if needed. Another frequently performed procedure is the transurethral resection of bladder tumor, or TURBI. During TURBI, the doctor uses an electric wire loop or laser passed through the cystoscope to cut away or burn off the tumor tissue. The tissue that is removed is then sent to a laboratory for microscopic examination. This helps confirm if the cells are cancerous and provides details about how deep the cancer has invaded the bladder wall. The entire biopsy process is generally safe and can be done under local anesthesia, where only the bladder area is numbed, or under general anesthesia, where the patient is asleep. The goal is to gather enough tissue to make an accurate diagnosis and determine the stage of the cancer. After the procedure, the tissue samples are carefully examined by pathologists who look for abnormal urothelial cells that indicate transitional cell carcinoma. In summary, a biopsy for transitional cell carcinoma involves collecting tissue samples from the bladder lining during cystoscopy, either by using a needle to take small cores or by removing the tumor tissue directly. This process provides vital information to guide treatment decisions and helps doctors understand the extent of the disease. Always remember, if you or someone you know is facing this procedure, consulting with a healthcare professional is essential to get personalized advice and care.